What's going on, everyone? Happy Monday to everyone. Hopefully, everyone is doing well and staying safe. If you had to take a COVID test, hopefully you have tested negative. It is time now for the Monday edition of the Pandemic Update for Monday, July 17th, 2023. Two things to note before we start today's Pandemic Update. Number one, I was unable to find an update out of India today, so yeah, there's no update for India today at the start of this video. Not terribly concerning because India is low right now. That would be a bigger concern to us if India was on the rise and I could not get an update. Second of all, as of this time of this recording, it's now after 4 o'clock. We're a little bit later than we wanted to be, but we were trying to wait for Walgreens to come in. And Walgreens did not update today. We'll check again while we're doing this update here, and hopefully maybe we'll get an update. The way that's supposed to work is if they do not update on Monday because it's a holiday, which today is not a holiday, they would update the day after, and we'll see. Maybe for some reason they're just going to update tomorrow. All right, very busy news day today. The first thing we want to talk about is new Northwestern study reveals alarming impact of long COVID on patients. And I wanted to share with you some of the statistics of this study. And first off, there are over 1,800 patients which were seen over 21 months from May 2020, until February of 2022. Researchers at Northwestern Medicine found that among those tested, 85% reported a decreased quality of life. 51% said they have had cognitive impairment, and 45% had altered lung function. 83% had abnormal CAT scans in the chest, and 12% had elevated heart rate on rhythm monitoring. So that is not good at all, and it just continues to show that, hey, we need to take long COVID seriously. And then we do have some economic news today out of China. The second quarter GDP growth, has to do with the GDP growth on the year. It is at 6.3% on the year, but it does say here that the recovery is slow. And mind you, China is one of the biggest economies in the world, so this is relatively concerning to see. And then we do have this, which was on Twitter. I shared something yesterday with our friend at Meet Jess. You remember Jess if you follow her on Twitter. If you don't, by all means, follow her account at Meet Jess. Always posts just wonderful stuff. I used to do a couple spaces with her, and I informed her yesterday that I found something from the New York Times, and I don't usually like to share the New York Times because it's paywalled. If I subscribed to every newspaper in the country, I would be broke. It would just cost me thousands of dollars a month. Can't do that. So, but Guantanamo Bay, once again, is experiencing a COVID outbreak, and there are 4 high-profile prisoners that have tested positive there, so that is concerning to see at this time. And now we move on to this, which will probably turn into me giving a little rant here, but is what it is. Doctors call for the return of COVID face masks in Scotland. That's right, some doctors in Scotland are saying COVID masks should return. And we often see conflicting reports in the media when it comes to masking. Some say it's time to ditch these masks, say, you don't need masks anymore. And then others say, oh no, you should continue to wear a mask. Here's my opinion on this. My best opinion I can tell you is do risk assessment and keep one very important thing in mind. It only takes for you to come in contact with one person who has coronavirus to change your whole entire life. First, you come in contact, then eventually you develop symptoms and you test positive, and let's just say it lasts for a long time, then you don't recover. Then comes long COVID. Some people die from COVID. Some people get hospitalized from COVID. Some people have problems down the line. Don't take the chance. Mask, because it's very important to mask, but again, I can't force you to wear a mask, so please do what is in your best interest. Consider going the smart route and continuing to mask, especially if you're going to a doctor's appointment. Think of it this way. You have seen me show my AeroNet 4 many of times. It's sitting right over here. Matter of fact, let me show it to you. It's this device right here, my AeroNet 4. It's currently at 806 in the room where I do my recordings, and that's below 1,000, so that is in the green. However, you go to doctors' offices, hospitals, emergency rooms, many different places where you're sharing the air, and as the day progresses, those numbers sometimes can go up higher and above 1,000. The higher that number goes, you see here, it can go to yellow, and it can even go to red. And when you're starting to get into the red category, even in the yellow category, that's relatively concerning. And in those higher categories, guess what? Viruses can transmit easier and you have a higher chance of infection. But there's one simple thing you can do to help control your level of infection. That's wear a mask. It's really simple to do. All right, let's move on because we do have a whole bunch of other things to talk about here. J&J expands global access to a tuberculosis TB drug as popular novelist joins advocacy campaign. This is some good news because we do need more effective treatments out there because there have been random cases that have been popping up in the United States and around the world. Continuing on. Now for some bad news, and we'll end today's news segment on some more good news, but we got to get to some bad news first. And first off, two Philadelphia police officers are mourned after dying on same day in unrelated, non-violent circumstances. So I've been following this news story, and back on Friday, two officers died at separate times throughout the day. First was earlier in the day, second was around the 9 o'clock hour in the evening, and they were just sudden medical emergencies. The one had to be given CPR, did not make it. The other, they tried to revive and they tried to take to the hospital. When he got to the hospital, unfortunately, she passed away. And this is relatively concerning. And someone brought something to my attention today. Officers were dying at a high rate of coronavirus in 2022. In fact, it was the leading cause of death of officers in 2022. So we know a high number of officers did have coronavirus, and some post-coronavirus complications could be part of the reason why they're having these sudden deaths. And moving on, there is yet another sudden death. A meteorologist has passed away who was on CBS, a beloved television meteorologist. She was 51 years old. And this is relatively concerning. We're seeing this happen at all ages. And it's just happening more frequently. And a lot of people say to me, oh, sudden deaths have always occurred. Yes, I know they've always occurred, but here's the issue at hand. They're happening at a much higher rate than ever before, and they're happening at all rates. And these sudden medical emergencies, for example, I was reading one earlier, someone who was only 15 or 16 years old dealt with a stroke. My friends, that is not normal. Only in very rare cases should that happen, and it's not happening in rare cases anymore. It's happening much more frequently than we ever used to see it happen before. Then we come to this over in China. Just thought I would give you an update on their monkeypox situation. 106 monkeypox cases were reported in China between June 2nd and June 30th. Then we come over to this. Some better news. There's actually some surprising news. Free COVID-19 testing, vaccine, and booster clinic in Beckley, West Virginia, of all states, West Virginia. How about that? And this is WVNS that reported on this. The reason why I'm talking about their news station, I want you to do us a favor. If you work at this news station and you're watching this, could you please do me a favor? I would love to get a report on some statistics of how many people actually show up at this clinic for a booster, a test, a vaccine, or whatever they showed up for. I would love to know how many people actually show up. That would tell us, if a lot of people show up at this, that would show the need for continued testing, the need for people to have easy access to vaccines. And finally, we move on to this. This is some fantastic news, folks. FDA has approved a new drug that protects against RSV in infants. As you know, there was a huge, massive surge in RSV last year, and now we're just getting one step closer to doing something about it. We actually have a new tool in the toolbox that can hopefully do something to help with the RSV situation. Now we have to talk about heat-related illnesses and where climate mixes with the pandemic update because climate's a real issue too. I have a whole other channel that is dedicated to climate and the weather forecast because that was my hobby before the pandemic. And, I wanted to make that hobby turn into a reality. And I want to start reporting on it. Just like I'm doing these pandemic updates, I now do a climate update daily. And I have a channel that is dedicated towards weather. I have it listed down below. It's at Climate Data Report, so follow that channel if you want to know more about what's going on in climate. And let's take a look at today's air quality levels. Really bad in the East Coast because we have that wildfire smoke, and we also do have hot conditions. We also have the wildfire smoke, which is ongoing up in the wildfires actually that are ongoing up in Canada. We now have California coming into the mix. There was a wildfire trending yesterday. I believe it's called the Rapid Fire, and that, my friends, is terribly concerning as well. So again, we do have bad air quality issues, and we also have heat related issues. And if you want to learn more about the heat related issues, again, check down below at Climate Data Report because heat strokes and dehydration, anything else that comes with a heat-borne illness, guess what? They are a real risk anywhere from California all the way across through to Florida and up the East Coast, anywhere that is seeing heat right now. Let's check here if Walgreens updated today. As of this update, I have not seen an update from them, and no, still last week's update still, so nothing from them yet. And as you know, with wastewater, Biobot Analytics, we did the wastewater update just yesterday, and as you know, the majority of the regions in the United States are rising. The Midwest one is rising, just not as fast, and I do want to bring one thing to your attention again from yesterday, and that is we're just going to take a look at the top two tiers here. 60 to 79% COVID detected. That's like moderate to borderline almost really high. There are 37 sites at that, and 80 to 100%, that's the highest level. There are 4 sites at that, and the reason why I'm bringing this to your attention again is because I'm concerned we're going to see the number of these increasing further. I was looking at more wastewater sites last night, or some that I already looked at, and there are several that are just fast tracking to moderate to high. So this is really concerning at this time, and I think it's safe to say we're in a surge right now. We're in a surge in the United States. Let's take a look. I'm going to move myself here to the left for a moment. Let's take a look at the latest variants. We hope to get another update on this, I believe, this Friday, but who knows anymore. Nothing happens as it's supposed to anymore. Look at Walgreens. We didn't get our Walgreens update today. XBB 2.3 is at 13.4%. XBB 192 is at 5.6%. XBB 191 is at 9.4%. Then we come down here to XBB 1.5. You know, the variant that caused the big surge over the winter. That's at 16.1%. XBB 116.6 is at 4.1%. XBB 116.1 is at 10.4%. Then our dominating variant is XBB 116 at 17.5%. EG.5, which I would love to know more about, is at 13%. I have heard some say that's what's causing Japan to rise. If you know anything about it, please let me know down below. It is now into the daily mix of things that I look up daily on Google to find information about to help make these reports daily. Alrighty, moving on now to this. And we do want to take a look at emergency department visits. And the overwhelming majority of the country is either stable or rising at this point, and places that are continuing to be stable will likely be rising soon because that's what we saw with a lot of these other areas. So emergency department visits for COVID-19 overall across the country are starting to rise. Very few countries, 1, 2, 3, 4, 5, 6, 7 are at this time are still dropping, and maybe it is 10 because there are 3 here that did not report, actually 4 if you include Puerto Rico. So yes, this is relatively concerning to see, and we're going to leave ourselves on the left here because we do want to take a look at some of these wastewater sites that show, various different things other than COVID, and we're just going to do a couple today. Let's come down here near Indianapolis, and look at this. Coronavirus levels are rising here. Influenza, not an issue. RSV, it was an issue going June into July. There was some RSV detected. HMPV, not an issue. Monkeypox, none being detected. That's good to see. Norovirus, there is some norovirus being detected at this time. we will do 2 more wastewater sites. How about up near Chicago? That's somewhere we want to take a look at. There's 2 sites up there. Here's one that shows wastewater for COVID is slightly starting to rise. Influenza is not rising at this time. It's not an issue. RSV is not an issue at this time. HMPV is not an issue. Monkeypox, no issues there. And an ever so slight increase in norovirus at this time. Let's go down here and take a look at another site. Let's refresh this because it just disappeared on us. And let's go down here and take a look at what's going on in the Orlando metro area. And wow, coronavirus is rapidly rising here at South Orange County, Florida. 183,000 people at this wastewater site. Influenza, not an issue. RSV was an issue to start the month. It has now dropped. HMPV, not an issue. Monkeypox, none being detected. That's good to see. Norovirus, there are some low levels of it being detected at this time. And let's move on now and take a look at New Jersey. New Jersey has 160 people in the hospital, but mind you, that number is likely higher as 9 hospitals are not reporting. 8 people are on a ventilator and 15 people are in the ICU. Now I'm going to move myself back to the right, and the next thing we want to take a look at is Philadelphia. And unfortunately, we do have some bad news about Philadelphia. Overall, in Philadelphia County, now this includes fire calls, they had over 2,000 calls. It was a very, very busy weekend. Let's actually read what they say. This weekend, Philadelphia Fire Department responded to nearly 2,000 calls, rescuing people from fires and accidents, helping displaced residents, medical and fire emergencies, and here's the roundup. 1,604 EMS incidents. That's really concerning. That's a lot of EMS incidents. And if we scroll down here, there were 756 on Sunday, and I believe it was around 850 something on Saturday. Yeah, here you go. Saturday was 851. So that, my friends, is a lot of ambulance calls. Moving on, let's just do a brief check-in on what's going on in Montgomery County, which is a suburb of Philadelphia. There's about 12 calls right now, it's saying. So that is a little busy. And let's take a look at Chester County and see what's going on there. And at this time, Chester County is not working. Okay, this does happen at times. Let's take a look at New York State. New York State added another 262 cases. The positivity rate is at 7.3%. The 7-day average is at 6.7%. And let's take a look at hospitalizations, because they did do the final day's update for last week. And on the last day of the week, look at this. Admissions did rise a little bit to 81, so that's concerning to see. And hospitalizations themselves in New York State, as it refreshes, did also rise. And here you go. Hospitalizations are at 395, 42 people in the ICU. How about New York City? Did we see a rise in New York City to end last week? And we did see a slight rise. 168 people in hospital, 20 people in the ICU. Alrighty, let's take a look at Texas. We'll get another update out of Texas on Wednesday. Combined probable and confirmed cases are at 4,482. The previous week was 4,682. Hospitalizations are at 518 versus 502. So if we know the hospitalizations are rising, it's likely they are missing a lot of COVID cases. And in actuality, because of testing, COVID cases are likely rising. And take a look at fatalities. That actually dropped by 2. 21 versus 23. Let's take a look at the international update real quickly. I'm going to refresh just because this updates constantly throughout the day. In the United States, cases are actually down 39%, but we're not actually buying that at this time because I saw the BNO update yesterday, and the BNO update says that cases are actually starting to rise in the United States, and that's with many states not reporting. I forgot to put that in today's update. I mean, we've been jam-packed with data and news here to begin with. I'll try to get that into tomorrow's update if I remember. Take a look around the world. 77% decrease in cases, 58% decrease in deaths. Not a lot of terribly concerning areas at this time. However, Israel cases are up 7%. And there is a 75% increase in deaths. That's simply because it's 7 versus 4. Then we come down here And we do see that Belgium is rising now with a 24% increase in cases, and Chile is seeing a 20% increase in cases. Alrighty, that does it for today's pandemic update. If there's something you would like to see me maybe add to this pandemic update that we do daily, let me know down below and I'll see what I can do. Can't make any guarantees because remember, we're at the time where there is less data. This week we will do the Hubbub World and their data. We will do an update video on that. We are overdue for a staffing shortage update, so I will try to get that to you maybe sometime later this week, because we didn't do one in June. At least I don't remember doing one. And trust me, there's a lot of things going on with staffing shortages. Just for an example, there was an incident in a prison down in Florida that was being blamed on staffing shortages. So we'll try and get that out to you later on this week. Alrighty, if you like this video, give it a thumbs up. If you want to see more content like this, subscribe to my channel down below. And if you know anyone that needs to see this life-saving information, because that's really what it's about here, my job here is to inform you on the news and data of the pandemic and any other health-related issue that's ongoing at this time. And, I just want to see you all stay safe because we really are all in this together. So if you know anyone that really needs to see this information, by all means, share this with them. The more people we get this information out to, the better, the more lives we can hopefully help save, and the more infections we can hopefully prevent. Alrighty, that does it for today's pandemic update. We'll have another pandemic update again tomorrow, but until I see you again tomorrow, stay safe, everyone, and thanks for watching.